Hi, class. This is Sumaya. I am talking today about respiratory acidosis. Respiratory acidosis is also called hypercapnia, is a state of carbon dioxide accumulation due to hypoventilation. Pulmonary as well as non-pulmonary disorder can cause hypoventilation. Healthcare provider must be mindful of readily reversible causes of respiratory acidosis, especially opioid-induced central nerve system depression. I highlighted this area because I think it's important to help differentiate between respiratory acidosis and alkalosis. As we can see here in respiratory acidosis, it's commonly associated with increase in the arterial partial pressure of carbon dioxide, decrease in the pH level. Normal pH level is between 7.35 to 7.45. In case of acidosis, the pH level reduced to below than 7.35. And the compensatory is increase in the blood bicarbonate. To compensate for the disturbance in the balance between carbon dioxide and bicarbonate, the kidneys start to excrete more acid and reabsorb more base to help normalize the blood pH level. Carbon dioxide is the main stimulus for the respiratory drive in the normal physiological state. Carbon dioxide play important role in the human body blood pH regulation. In normal balance body state, the body maintains the carbon dioxide within a normal range, which is between 38 and 42. By balance, its production with its elimination. Respiratory acidosis is always represented by change in the bicarbonate level. Carbon dioxide increases the hydrogen ion, which lower the blood pH. In hypoventilation, the body produces more carbon dioxide than it can eliminate, which causes retention of the carbon dioxide. As a result of the increase in the carbon dioxide, the hydrogen ion and the bicarbonate increase as seen by the right shift in the following equilibrium. So in this equilibrium, as we can see, the bicarbonate and the hydrogen ion, both of them increased. But the bicarbonate increased to compensate the increase in the hydrogen ion. The increase in the hydrogen ion caused decrease in the pH. Chemoreceptors are more sensitive to any alteration in the acid-base balance. If there is increase in the arterial CO2 level, indirectly stimulate the central chemoreceptor and directly also stimulate the peripheral chemoreceptor. The body tries to maintain and minimize the change in the pH by activating the compensatory mechanism to keep carbon dioxide ratio constant. The body compensates differently in acute and chronic phase of respiratory acidosis. In acute phase, the respiratory acidosis, in acute phase of the respiratory acidosis, the buffering occurs via the protein, mainly hemoglobin. But in chronic phase, the body compensates by trying to keep more bicarbonate to overcome the acidosis. The kidney excrete carbon dioxide in the form of carbonic acid and reabsorb more bicarbonate. This process helps to maintain acid-base balance near normal and prevent the pH from becoming low. This process usually takes between 3 to 5 days for maximum response. Long-term respiratory acidosis can affect the central nerve system, which makes the patient feel a headache and disturbed in the sleep pattern and drowsiness. Risk factor. In acute case, the risk factor, sometimes it can be any change happen in the lungs parenchyma, such as pulmonary edema. It can also happen because of asthma or any exacerbation of the chronic obstructive pulmonary disease. It can also happen due to defect in the neuromuscular system, like spinal cord injury, or any also trauma, for example, to the chest wall, and overdose of any kind of drugs that affect the central nerve system, such as narcotic drugs. In case of chronic respiratory acidosis, the patient usually in the chronic respiratory acidosis maintain high level of PCO2. So any problem happen to this patient can exacerbate the situation, and as we said, it can cause acute or chronic respiratory acidosis. Decompensation usually happen because of because of the development of additional infection, or when the condition becoming more severe, so the body cannot tolerate more, so it decompensates. The major sign and symptoms, it can be different, also depend on the equity of the situation. If it is very acute, so the patient can come with alter in the mental status. It can come also with seizures-like activities, and it can develop dyspnea or rapid deep breathing, which called cosmal breathing. Cosmal breathing is, we can say, the hallmark of acidosis. If there is acidosis in the body, the patient usually develop cosmal breathing, which is rapid deep breathing. Secretion of the urine with low pH, the patient also can develop an anxiety and wheezing. In other cases, the patient might present with cyanosis because of hypoxia. As we know, hypoventilation can also cause hypoxemia. The high level of carbon dioxide can cause cerebral vasodilation. Cerebral vasodilation can increase the intracranial pressure and the papilloedema, which increase the risk of herniating and the possible death. In chronic respiratory acidosis, the patient might develop memory loss, impaired coordination, polycythemia, pulmonary hypertension, heart failure, daytime somnolence, and headache. Diagnostic test. The most important diagnostic test is arterial blood gas analysis, which is the first things to do if the patient develops short of breath. And it can help to find out how much is the pH level and how much is the CO2 level, and of course the oxygen blood level. The pulmonary function test and chest X-ray also, it can be done because it helps to find out the cause of respiratory acidosis. My presentation finish here, and this is my references. So please feel free if you have any question or comment. Please feel free to let me know. Thank you so much for watching.